Hi, everyone. Welcome to another episode of Enabling Tomorrow. My name is Tim Metz. I'm your host for today, and we are talking with Javier Cardona, who is the CEO and founder of OneDoc3. He will explain the name in Spanish in a bit, which is a nice story. He runs the OneDoc3, which is a telemedicine company based out of Bogota, Colombia. The company has already over 1 million active users per month and close to 150 million medical recommendations provided. And previously, he worked also in the technology sector. So really interesting to hear his story, and especially in these times, of course, with COVID, to see what his company does and how it has affected the operations. Before we get started, if you like these episodes, you can subscribe directly on our YouTube channel, where you'll be notified. And if you want to stay up to date on everything KaiOS, then you can follow our social media accounts. So with that out of the way, let's get started. Welcome, Javier. Thanks so much for joining us. And to get started, can you, so that everybody really understands what your company, what your organization does, can you give me the elevator pitch of what you do and what it's all about?
Sure, Tim. Thank you for having me. It's a pleasure to be here. Basically, at Undoc3, what we do is we provide telemedicine services. We are the largest telemedicine platform in Latin America. We're providing around 300,000 consultations a month in Colombia, in Mexico, in Peru, in Ecuador, and in some other couple of countries in the region. Our idea is to use AI at our core and allow users to better identify their symptoms, and also doctors save time by using the platform because it already presents a pre-diagnosis and triage and some other classifications, so the doctor can use their time to actually provide a good service and a resolution to our customers. So that's what we do. We've been running for 5 years already. We have around 500 doctors on our network, and we are really happy to be able to help a lot of people during these difficult times. We're very proud of how the team and the platform have responded. Just to give you an idea, we're doing 14 times the number of consultations that we were doing in March. Oh, wow. So that's an interesting number. But in the end, it's helping more people get faster, easier, and affordable access to healthcare. And that's what we are always working on.
Yeah, wow, that's great. Yeah, and I would love to talk a bit more about the pandemic and how that has affected you. But first, like, how did you get into this? Like, do you have a background in medical background, or was it different? Like, how did you get this idea and decided to go for founding this and doing this?
Sure. Well, it was more a coincidence. My background is telco and technology, like for almost 20 years. I used to work for Telefonica for 10 years, probably. Yeah. Doing business development and product development, and like everything that came out, it was my responsibility. So I was always like launching new services and always curious about technology and the improvement it can bring to people's life at scale. Well, yeah. So after Telefonica, I moved to the UAE. I spent 3 years in the Middle East. Okay. That was my first experience with entrepreneurship. I launched a SMS-based service in the Middle East. The idea was to help immigrants from Southeast Asia to the Middle East get local content, or like content from their countries on their phones. Like I'm talking about working class in the Middle East, from India or Bangladesh or Philippines. It was pretty successful. And while being in the Middle East, in Dubai, I had this need to go to a doctor, and I didn't know what to do. It was 2013. Yeah. I didn't know any doctor. Yeah. So I just started Googling about my symptoms. And basically what I wanted to do is to talk to a doctor, as we're doing now. Yeah. Phone, chat, whatever. But back in 2013, it just wasn't possible. So that's where the curiosity triggers, and I knowing a little bit of technology and knowing that this should be possible, you know, and it wasn't. So that's where the company was born. I became obsessed about this, bringing doctors to people, or in a seamless way, in an affordable way, using technology. And well, it's been almost 6 years running the company, but that's how the company was born.
Wow. And so what in that beginning, like when you really started, like what were some of the biggest obstacles? Like was it regulatory, or just like any startup, like getting funding, or what was difficult about getting it going?
Well, it was really there were and there are many challenges always, but at that time, convinced doctors to join was pretty difficult
Uh-huh.
because of the legal liability and all this.
Yeah.
At that time, when we launched the first version of our company, it was more a Q&A site, like a medical Q&A site, kind
Yeah.
of quota kind of product, but the answers were provided by doctors.
Mm-hmm.
So it was quite funny to see how the problem that I experimented when I was doing my search about the medical problem that I had, it was like a lot of people problem. So we never struggled getting users on the platform. It was really easy. The
Okay.
problem was always to get enough doctors to serve
Mm.
those users and have the right incentives for them. So that was probably the biggest challenge. But as soon as we launched, we have a lot of users, probably 10,000 users the first month, and then we double because I mean it was a problem. A lot of
And
people
nobody else
needed.
was doing it at the time because you launched it in Colombia, right?
Yeah, well, the idea it was in the Middle East,
Yeah.
but then coming from Latin America, where even access to healthcare is even harder than in many other countries, and also having an interesting market, 500 million people speaking Spanish, native speakers. So it was a big market. So that's where I decided to go back to Colombia and launch the company. Um, and it was amazing to see how needed it was a product.
And why is that? Because it's for people who've never been to Colombia or to Latin America, like why is it difficult for people to get to a doctor or to a hospital? Like what's the local situation like?
Access to healthcare is tough in emerging markets because couple of reasons. The first one, there is no enough doctors, right? So in Latin America, it's only 1.9 doctors per every 1,000 people.
Okay.
And that's a very small number. And the
what's
other
the number?
is,
do you know what is the number in US or Europe or other countries?
yeah, it could be around 6 or 7.
Oh,
right?
okay. Wow. Yeah. It's a bit different.
And the other problem is how low coverage there are in terms of insurance. So only 5% are able to afford medical insurance, like private medical insurance. The other 95, they just have to go with whatever is available from the public sector, government, or whatever. So just to give you an idea, it will take you from a day to a week to just talk to a doctor, right? So that's a problem we're solving. Right now, you can just grab your phone and talk to a doctor or chat with a doctor in seconds, and that's what we're doing now. But it's been a long way until we get to what we are doing now. But we're focused on providing access to helping people or telling people what to do next if we're not able to solve the problem that they have.
And so how has the service evolved from like, you said it started kind of as QA and now people can talk to a doctor, and you're already using or you want to use the AI, or you mentioned it at the beginning. How does that work for the user?
Well, it was born as a Q&A platform. What happened in the middle is that we answer probably 120 million questions, like medical related questions. So what we did like 3 or 4 years ago, started building a medical knowledge base out of those questions and out of the medical knowledge from our doctors, right? So what we've done during the last probably 3 years is build on top of on that knowledge base, NLP capabilities and some other machine learning capabilities that allow us to, a year ago, launch a symptom assessment service that can then real-time triage and pre-diagnose and do some classifications. So the doctors have more information and better information to solve your case. And now we're doing it not as a Q&A, asynchronous consultation, but we're doing it real-time, text-based via chat or also on video. And the technology is the part that is allowing us to scale and to serve a lot of people, because we use probably 50% of doctors' time per consultation compared to like a normal in-person consultation, because all this first part of the questions that the doctors make are done already by the platform. So that's how we use it, how we use the artificial intelligence. It's still very early on this journey. We're working on accuracy, we're working on more diseases, we're working on many things and creating more tools so the doctors can use the time as effective as possible so we can serve more and more people every day.
Mm-hmm. And then, because I mean, it sounds on the one hand very logical, like that it's possible to do this, right? Like how we are talking now. But then if I think about when I go to the doctor, which is luckily not very often, but even if it's something basic, like at least half the time the doctor needs to do something like, I don't know, measure my heartbeat or have a look at it. Like how does that work when you do it virtually? Like at what point can the doctor resolve it, and at what point do you need to send somebody to actually go to the hospital or go see it? Or like how much of things can be resolved, and how do you address, like if something really basic that you would normally do in person, how can the doctor do that virtually?
Well, it's a lot of training also on our medical team, because the kind of questions we ask and the kind of information we're trying to collect somehow is trying to not replace, but get more ideas on what you might have. Mm-hmm. So some symptoms, and a good example right now with COVID is fever, right? Mm-hmm. What is really fever? And because some people think that some degrees are fever, but are not really fever and things like that. So doctors do a lot of, or try to collect as much information as possible because of the experience they have already doing this virtual consultation, because we've been doing it for quite some time. But there is a percentage of times where we're able to solve. There is another percentage that we require you to go to an ER or to a primary care kind of service. But every time you finish, or a user or a patient finishes a consultation on our platform, they say, what would have they done if this service didn't exist? Mm-hmm. And so far, at least during this year, 67% of the times, they would have gone to ER or to a primary care kind of services, and we avoided that. So that's the kind of impact that we see. On the other 32% of the cases, people still need to go because whatever the symptoms are, or their chronic conditions, like there are many scenarios, but in many cases we're able to solve, and it has a great impact not only on the patient side, but also on the system side. Because if you don't go to a place, to an ER, and you didn't need to go, you're leaving that space for other person, and we don't have enough resources in these emerging markets, in these emerging countries. So that's double impact. I call it that way.
Yeah, that's very interesting. And then, so do you get also, like, is the payment only from the patient, or is there also something from the government, or let's say the system, that they see that you're actually relieving them, and they also, I don't know, provide some kind of subsidy, or like, do you work together with the government, or how does that work?
Well, that is a great question, and that's something that at Undoctres we've been able to somehow discover and work through. Basically, at Undoctres, we make sure every patient receives care and every payer sees a tangible impact. So when I mention payers, as we do work with insurance companies, we do work with public insurance companies or the ones providing like this social security kind of service. And we work also with employers, right? So the idea is that we help insurance companies reduce cost and serve more people and use their resources more efficiently. It works for private insurance companies. It works for public insurance, social security kind of services, and it works also for employers, right? So we also do that, and on a very small percentage, we have a consumer product where you can go to our platform and pay, but that's not the big volume. The big volume comes from the system, from the insurance, from the public payer. And that's very important, and that's pretty unique, at least in Latin America, where we have integrated very deeply with the system. That's why we're serving so many people, because otherwise, if I charge you $2 or $3 and you have those $3 on your pocket, but you don't have a digital way of payment, which is the case in the region, you still wouldn't be able to afford. So the idea of Undoc3 is not only provide a great service, use as much as we can the technology part, but also integrate with payers so more people can access. With the COVID situation, we're even working with governments, providing assistance for free to the most vulnerable people in the region.
Yeah, so actually that's a good bridge to talk about how's this year been, also for you personally, like not just in the company. It must have been crazy, no?
Oh, it's been 145 days on lockdown in Colombia, probably the longest in the world. But it's been amazing for the company to be able to serve so many people at this level in different countries. People that are COVID-19 positive, but the case is moderate, so we can have them at home and do follow-ups with them. That's been an amazing journey for us. It's been quite hectic. It's been 5 months of practically almost no sleep. Not only from my side or engineering team, but from the operations part. Doctors are working like crazy. But it doesn't matter. I mean, we know that this is our moment. We have to play an important role in this situation, helping people, helping the government, helping everyone. And that's what we're doing. We've saved lives, and we're very proud of that. So it's been probably a very weird year working from home, working all the time, but it's worth it, totally worth it. So we keep adding more insurance companies, more alliances, more partnerships, and every day we're serving more people. And the good news for us is that COVID-19 changed for good the telemedicine landscape. Telemedicine is here to stay. We probably 5 years of adoption happened in 4 or 5 months. And a lot of that is not going away because people try it. Many people haven't tried telemedicine before. Now they have. Payers tried telemedicine also, and regulation became more flexible. Now, like, because of the situation, we're able to do many things. So it's a great moment for us, and we're just working like crazy to be able to serve more and more people every day and integrate with different services and create an ecosystem that with the goal of providing a real resolution for you. Okay, on 67% of the times we solve your problem, but create a gateway to route you into the system for the other 30-something% of the cases.
Yeah. So what does a typical day for you look like at the moment, like as managing this operation in such a time?
Well,
can you walk me through that?
Sure. Well, the first thing in the morning is look at the numbers, right? There's and there is some days there are crazy things like customers that double or triple the number of consultations. I'm talking about insurance companies or this. So we check on the numbers. That is nothing weird. We check on like critical cases that we might have. Then we with our primary team, with my team, we check on like the most urgent matters that we need to solve, because of the speed that we've been growing. Some bugs happen on the platform, some things we need to fix. And so it's like everyday prioritization, because we're under some stress. The platform is under some stress that never been before. So many things come up, and then we just try to go country by country, checking on the important things that we need to address. Also, a lot of what we call business development, or how can we serve more people and bring more customers on board.
Yeah.
We also do some product work, because now we're learning pretty fast, and we get a lot of user and customer feedback. So we just check on what features can we add to the roadmap, and why, and some experiments. Well, that's pretty much the day now. 100% focus on the operation. Probably some plans that we have on the roadmap have been put on hold, because it's not the time to add more features or some other things. We just need the platform to work and keep scaling. And that would be it. Probably. Well, yeah.
Was your team already distributed and virtual, or before the lockdown you were going to an office together?
Well, we have team in Colombia and in Mexico. So in Colombia we were 100% in the office.
Okay.
We like that.
How was that switch?
Well, it was pretty easy. It was pretty easy, and we haven't had like any time to think, because we're being super busy.
Yeah.
But there are good learnings. I think we're gonna stay remote first, at least officially until February 2021. We're not going back to any office, because it's been slow in Colombia and in Mexico. We haven't had the peak yet, and we don't know what's going to happen next week or next month.
Yeah.
So we decided to announce that we are remote first and working from home until February. A lot of learnings. We miss the informal conversations. We miss these moments of coffee time, but something good idea comes up and things like that. So that's a part that we miss. And the other part that has been interesting is hiring more people. We've been hiring more engineers. We've been hiring more people and remote first for the first time. So that's been a challenge. But I think we're a startup, and we have to adapt pretty quickly, and that's what we've done with the remote working. And in general, I would say that team is pretty happy. Probably we're working longer hours than ever before, but well, that's also because of the situation.
Yeah, that's understandable. So what is your dream? What is the big goal? Or what do you would like to happen in the coming years?
Well, basically, my dream is that Undoc3 is the place to go when you have any concern about your health. So the first thing you do is grab your phone and go to Undoc3, and because you know that you will find whatever you need there. You'll be able to talk to a doctor, to a psychologist, to be routed to the next level of care that you need, if that's the case. So we call it world-class primary care on your phone, and basically be the gateway. And it's ambitious goal, but from the experience that we're gathering during these times, it's very doable. We see that's probably 6 months ago, we thought that that was going to take 5-7 years. Now we are sure that we can get there in 2 or 3 years because of the scale that we're getting and because of the adoption from the users. And this is not only my goal, but the team's goal. And from the doctor's perspective, they see how this is having the impact that they never thought before. And the level of motivation of everyone in the team is so high right now that we it's like we have the superpower and we know we can do it, and we're working really hard to get there.
That's great. And do you also see a shift during these times from the type of people who are using the service? Because if what you just described sounds like it can be eventually for everyone, right? But initially, I think it was more for people who have difficult access and maybe cannot afford the medical care. But do you now see it also shifting to, let's say, also middle class people and even richer people? Or what is kind of the buildup of the people who use the service?
Well, actually, it's going to lower income people.
Okay.
Because in this region we still have connectivity issues. There are some good numbers of smartphone penetration, but doesn't matter if you have an Android phone. But if it's a $25 Android phone, it's not that very good, right? So we're doing actually adoption from lower income people because we have this text-based service, so you can chat. So the connectivity is not an issue. So what we're seeing is adoption even faster in the lower income part of the pyramid, and also I would say everyone, because if you had a great private insurance product, you could go to the best doctor, but now you have to do it virtually. So it's like everyone has tried somehow and is seen that it works. So many of those consultations are going to stay virtual. So we are seeing a general adoption. Probably the most surprising part is how the lower income people are accessing the services and experiencing for the very first time that they have a decent access, and it's the same access for everyone. So that's also great impact.
And then in that case, so then it goes through SMS. Is that correct?
Well, it's text-based. WhatsApp has done a great job educating people how to chat.
Yeah.
And everybody uses WhatsApp here.
Yeah.
So since it's chat-based, we don't use SMS that much, probably just for authentication and things like that.
Yeah.
But yeah, it's more chat-based.
Okay. And then as a last question, because we're getting close to the 30 minutes, do you see, like, because I'm not sure how much telemedicine is actually popular and used already in more established markets, but could it be that actually emerging markets will kind of leapfrog or actually go faster now because they are more the telemedicine is more appropriate for them to use it there, and people in let's say US or Europe, they would much easier just they're used to go to the hospital to the doctor, so they would not think about using it, whereas in this case now you see a much faster adoption and more people use it? Or is telemedicine already also quite popular in other regions, not in emerging markets?
I think the COVID-19 has accelerated this everywhere. I read something like in the US, pre-COVID, 1% of the consultations were virtual. Now that number has probably multiplied by 20 or something, whatever the number is.
Yeah. So
that's happening everywhere. But what we're seeing in emerging markets is that we are avoiding 3 or 5 years of adoption, right? Yeah. So it's the same technology, it's the same the handsets, it's the same. Many things are the same. We're just doing like a faster adoption. And because of the access problems that we experience, probably that's something different. If you're in a developed market, you wouldn't suffer that much for for accessing. But in emerging markets, this is like, I can do it now, and that's a totally different picture.
Yeah. Okay. Yeah, this is great. It's really nice to hear what you're working on and how it's developing and how it's helping in these times. Is there anything that you'd like to add that I didn't ask, or is there anywhere people can follow your work, like social media or website they should go to if they want to know more?
Oh, yeah, they can follow us on Twitter at Dr1Doc3. They can find us there, and basically, thank you for having me and allowing us to tell our story. It's similar in every emerging market, and we are very excited about what's coming in the next 6 to 12 months, because things are going to change radically, and we are going to be playing a very important and interesting role in that new reality that we still don't know how it's going to be, but it's going to be different.
Sure. Yeah. I wish you the best of luck, you and the team, Javier, with that. Thanks for sharing your story, and we'll keep an eye on it. Great to, we want to also see where it goes, and nobody knows, of course, what next year will look like. So, yeah, good luck, and we'll keep in touch. And thanks everybody for watching. If you want to see these as soon as they come out, these videos, then subscribe to our YouTube channel, and also you can of course follow us on social media for everything KaiOS, and see you next time with another guest in Enabling Tomorrow. Thank you for watching. Bye-bye.